Metafix external fixator system, deformity correction fixator with compression, distraction rod, by NAFS Medical.
Monoplanar compression distraction external fixators are widely used and offer superior features, particularly for pathologies of the tarsal and metatarsal bones. For this reason, they are sometimes the primary choice and sometimes the sole option, acting as a surgeon's rescue. Cannulated compression screws and specially shaped plates are frequently preferred for indications of tarsal and metatarsal bone fractures and deformities.
However, in the following cases, external fixators should be chosen first. 1. Metatarsal shortness, brachymetatarsia. 1. Distraction arthroplasty for hallux rigidus. 2. Failed first metatarsal joint fusions and tarsal joint fusions. 3. Metatarsal pseudoarthrosis, especially the fifth metatarsal base. 4. Lapidus procedure for hallux valgus, first metatarsocuneiform arthrodesis. 5. Tarsal or metatarsal deformities in the diabetic foot. 6. Tarsal or metatarsal deformities of Charcot-arthropathy. 7. Tarsal fractures due to gunshot wounds. 8. High-energy and open tarsometatarsal complex fractures. 9. Active tarsal or metatarsal infection and/or osteomyelitis. The advantages of treating these pathologies with an external fixator are as follows. 1. It is minimally invasive. 2. It can be used safely in patients with infection or high-risk patients. 3. Gradual compression or gradual distraction can be performed. Deformity intervention can also be performed after the surgical procedure. 4. The rate of fracture union and fusion is greater than 95% with fixators featuring distraction compression properties. 5. Because fixation rigidity is generally sufficient, the patient can bear weight early. 6. After healing, the external fixator can be easily removed in an outpatient setting, leaving no implant behind.
Challenges and risks of using an external fixator. 1. The presence of a relatively bulky device outside the body. Most patients initially complain about this, but they quickly adapt. 2. Pin site infection. Superficial soft tissue infection and serous discharge occur at the skin entry points of transmission screws in nearly half of patients. To both prevent and treat this, the pin sites must be kept clean and regular maintenance is necessary. Antibiotics are rarely required. The likelihood of a serious infection requiring fixator removal is very low. 3. Pin failure. If a pin with a smaller diameter than necessary is used, the pins may bend or break after loading. The pin diameter should be proportional to the diameter of the bone being used. If the pin is larger than 30% of the bone diameter, there is a risk of bone fracture. If it is smaller than 20% of the bone diameter, there is a risk of pin bending or breakage. The ideal size is around 25% of the diameter of the bone being used.
The Metafix system includes pins in 2 diameters for external fixation surgery. Their appropriate applications are listed below: 2.5 mm, first phalanx, first metatarsal, other metatarsal bases, and tarsal bones, 2.0 mm, second, third, fourth, and fifth metatarsal bodies, also proximal phalanges.
Features and advantages of the Metafix external fixator system. Design. Classic fixators are shaped like a finely threaded shaft in an aluminum casing. The Metafix body consists of a D-shaped, M6 diameter threaded rod. Its overall size is smaller, making it appear more compact. Bone transport. A third clamp cannot be added to conventional systems. Therefore, bone shifting operations cannot be performed. However, with Metafix, it is possible to use 3 or more clamps, and all types of bone shifting operations can be performed. Angled pin clamp. In conventional systems, clamps and pins can only be positioned at a 90-degree angle. Angled or cross-pinning is not possible. However, with the angled clamp in the Metafix system, pins can be inserted into the bone at any desired angle, cross-pinning. Angled pin application maximizes rotational stability while maintaining axial stability. Fixation with an angled clamp is recommended for stability of the free fragment, especially during displacement. Lengthening or bone segment transporting of metatarsals with an angled clamp is only possible with Metafix. Graduate nut. With conventional fixators, the amount of compression or distraction can only be monitored approximately using a ruler on the body. However, the Metafix system features four-sided graduated nuts. Each 90-degree rotation of these nuts represents 0.25 mm of advancement. Compression or distraction is monitored with a precision of 1/4 of a millimeter, and advancement is strictly controlled.
Some surgical applications with Metafix external fixator. Brachymetatarsi, lengthening a segment less than 2 cm. Brachymetatarsi, lengthening a segment more than 2 cm. In cases of brachymetatarsia, it is recommended to include the proximal phalanx with a third clamp to protect the proximal interphalangeal (PIP) joint, especially when lengthening the fourth metatarsal. Especially if lengthening of more than 2 cm is required, the PIP joint cartilage is subject to crushing and damage as the lengthening progresses. The proximal phalanx should be included in the fixator with a third clamp, and the clamp on the PIP joint should be advanced at the same rate with each metatarsal lengthening. This protects the PIP joint and achieves the required length. This feature is available in very few fixators on the market. Currently, it is the first and only one on the Turkish market.
Hallux rigidus is distraction arthroplasty. Distraction arthroplasty with an external fixator should be the first method to be tried in the treatment of hallux rigidus, especially in the early stages. This method opens the joint space and allows for cartilage regeneration. Patient satisfaction rates are high. Studies have shown that patients do not require any additional treatment for at least 2 years. Hallux rigidus, arthrodesis. The treatment for advanced stages of hallux rigidus is the first MTP joint arthrodesis. Arthrodesis should be performed with a compression external fixator, especially if it is performed in the setting of failed internal fixation or arthroplasty. Metafix can also be safely used in other tarsal joint fusions.
Pseudoarthrosis.
Especially fifth metatarsal base fracture non-union. The fifth metatarsal base fracture is one of the most common foot fractures. Stabilizing the fracture is quite challenging due to the strong muscles attaching to it. Inadequate fixation is a common mistake. Consequently, pseudoarthrosis is quite common in this area. Plate fixation can sometimes be inadequate. In such cases, treatment can be successfully achieved by combining the stable fixation and compression properties of Metafix.
Lapidus procedure, arthrodesis of the joint between the first cuneiform and the first metatarsal. The Lapidus procedure is a widely used surgical technique described for the treatment of hallux valgus. It is based on the principle of fusion of the first metatarsal by freeing it from its joint with the first cuneiform bone, correcting both rotational and angular deformities, and then fusion of this joint. This fusion is most often performed with internal fixation such as cannulated screws and plates. However, there is a risk of failure to develop fusion or loss of correction. Using a stable external fixator with this procedure offers 3 key advantages. 1. The resulting correction is more durable. 2. The patient can walk on it early. 3. Compression allows for earlier union of the fusion line.
Some clinical cases with external fixator. Shortness of fourth metatars bone. Shortness of first metatars. Combined shortness of third and fourth metatarsals. Hallux valgus treated with Lapidus procedure.
Results and patient satisfaction. Clinical studies have proven that monoplanar rail-type fixators in foot surgery provide early mobilization and high fusion rates. They offer unique features in some indications. The average fixation period for tarsal and metatarsal pathologies is 8 weeks. Most patients begin weight-bearing within 1 week and tolerate it well. The postoperative period should be supported by physical therapy. The risk of complications is quite low, and the vast majority of patients achieve full functional recovery. Pain and discomfort are minimal, and satisfaction levels are quite high. The Metafix external fixator is a new, versatile, adjustable, reliable solution for orthopedic foot surgery that prioritizes patient comfort. It can be used in a wide range of indications and aims to become an indispensable component of minimally invasive approaches in modern foot surgery.